Ciao, io sono Valerio Salvi e questo è Salotto 32, il podcast per i professionisti del settore dentale. Okay, we are back from Growing Smile in Turin with Dr. Steffen Decker. Hello, Steffen.
Hello, buongiorno.
You have a great Italian, but we will go ahead with English.
Please. Yeah, it's better.
My English is not like your Italian, but we will try.
No problem.
Steffen, first of all, what do you think about the main topic of this Congress?
Well, actually, it makes me quite emotional that finally we have a Congress about growing smiles, about children. Because I'm based in UK, I'm German, but I'm based in UK. I'm very alone in the UK doing prevention on children. And to finally have the audience who actually will listen to what I have to say and the need for interception, it's such an amazing feeling that I finally at the position and the location where 300 people collectively want the same thing, to help children. So I think it's an amazing idea. It's a way forward, and I hope it will just go crazy.
Yeah. Just a little preview. In this interview, we want to define a preview of your lecture of tomorrow. And I would like to ask you, let's talk about problem with breathing and tone position, the relation with...
I think we need to go further back. Like, I moved to London 10 years ago, and at the time, I came from Switzerland with my training on kids and prevention. Then I moved to London, and the main patients I've seen in London suddenly were adults. Mm-hmm. So there were no kids to be treated.
No kids.
So I treated them with lingual braces. And then about 5 years ago, I got headhunted by a kids clinic, and I found that the kids are still existing in the London. And I found aligners as the approach. But what's happening really is the competition in the adult market is so big, because every dentist, 80% of aligner cases in the UK are being done by dentists. So me as an orthodontist, to be different, and if I would choose to do adults, I'm not different than any other dentist, so the differentiation is price. But when you treat children, not only you do something great because you help children to grow nicely, but also you're in a niche in the UK because you're the only one. So you can change lives and you grow as a business because you focus on a complete different group of patients. And now if you add the component of breathing into it, when you see a lot of adults, you see the problem they're having 30 years later. But how about when did this problem actually start? And this is exactly what I will talk tomorrow about. Mm-hmm. When are the first signs of these difficulties? When do we see them at 3, 4, 5, 6? And how do we prevent them from happening first place? Because when I do my consultation on children, actually quite often the parent will sit in the corner and self-assess themselves. And then they will come back to me and say, excuse me, I have all of the symptoms you just described the child will have. So they went through the system and they had treatment too late, they had teeth extracted, and they are suffering now. And this emotional journey I have frequently in my practice. And to answer your question, so breathing is completely neglected in our area. We focus on teeth. We focus on bringing them into a class 1. But it's not about the teeth. It's about health and healthy growing. So it starts much earlier than that. And the impact of breathing, when we change that, is far bigger than making nice teeth. So, and the tongue plays a very, very important role in that breathing, because the tongue should rest in the palate. But if you ask in the audience and you go in a primary school, you will see 30-40% of the children in the class have their mouth open. Mm-hmm. So they have mouth breathing. Hence, the tongue is not sitting in the palate. It's sitting in the lower jaw, which has ultimately a consequence of the anatomical structure of the upper jaw. Mm-hmm. And every case we've seen this morning were all the problem in the upper jaw and the lower adapted to it. So it was all a tongue positioning problem and breathing problem. And that's why we have to focus much more on the diagnostic of breathing disorder, sleep disorder, breathing. And that's why what I'm talking about tomorrow.
Nice. What do you think? What's advantages or limitation in your experience for the use of the aligners with young guys?
I don't think there's any limitation, because
Okay.
when I first started that 5 years ago, I had the opinion kids will not wear it. And that opinion is out there, and kids are hard to manage them, whatever. But what I realized is kids are the best patients. Compare them to a teenager or an adult, they're much more compliant than any of the other. And also, what can potentially happen in a kid's case? They might lose it. We go to the next aligner. They lose an attachment, doesn't matter. Yeah, they wash it, no problem. They eat with them, no problem. So there's not a lot of problems actually that can occur in their treatment. And also because the teeth move very easily in kids, because the jaw is so malleable, and we can basically change aligners very frequently, and that helps us to manage the kids. So I think there's actually no limitation. The earlier you start, the less limitation you need, because you prevent the problem.
Okay.
So there will never be impacted teeth. Of course, if you wait too long and you get impacted teeth, that will become more and more challenging with aligners. But if you do early prevention before age of 9, there will not be a lot of problems happening later. Hence, there's no limitation.
Yeah. Okay. And do you think that biomechanics with a aligner can improve or positively influence the breathing in?
That's more, look, breathing is not as easy as you use aligners to move teeth. Breathing is tissue, is allergies, is nose, it's airway in the back. So breathing is a multifactorial problem.
Mm-hmm.
Aligners can help to change the tooth position and the palatal shape.
Okay.
Hence, it will make the tongue maybe go up with help of myofunctional therapy. With myofunctional therapy and ENT to check for allergies, that could improve breathing. But there's no direct link between tooth movement and biomechanics and improvement of airway. This is too easy. Airway is complex.
It's a part of the
It's
problem.
a part of the journey, and that is our part we have to play in the whole game.
Okay. So, Steffen, thank you for joining us.
No problem.
Enjoy the Congress.
Thanks.
And we are all set to follow your lecture tomorrow.
I'm super excited to go speak tomorrow. I can't wait. Thank you so much.
Thank you so much.
Thanks.
Anche oggi siamo arrivati alla conclusione di questa puntata. Grazie di averci ascoltato. Se vuoi, puoi seguire anche le puntate video e alcune dirette sul canale YouTube di Marketing Therapy. Salotto 32 è un podcast di Marketing Therapy, scritto e diretto da Valerio Salvi, supporto alla comunicazione di Valentina Sabatini, post-produzione e montaggio di Francesco Caputo.